My name is Wanjikongari. I'm a CNA, lab technologist, anesthetic assistant based in Nairobi, Kenya. In today's video, I'll be discussing things that you should let your anesthetist know before surgery. If this is the kind of videos that you like, kindly consider to like, share, and subscribe. Now, without further ado, let us jump right into today's
Welcome back.
Today's video, I'll be discussing things that you should let your anesthetist know before surgery. Kindly note, whatever I say in this video, it is my own opinion. Sawa sawa, or how we do it where I work. Sawa sawa. Now, the first point, your last meal. When you are admitted, you will see sometimes like NBM, nil by mouth. There are some people who will write NPO, nothing per oral. Those are some of the terms, meaning these patients should not be fed. At least at night, the night before surgery, you should not eat heavy meals. If you're gonna eat heavy meals, it should be 8 hours, at least 8 hours before surgery. Things like snacks, we give it at like 6 hours. Things like breast milk, 4 hours. Clear fluids, at least 2 hours. Yeah. Ensure you don't lie to your doctor your last meal. The reason we ask the last time you fed, we are avoiding something we call aspiration. The anesthetic drugs that we usually use in our OR, they cause something we call nausea and sometimes even vomiting. So suppose you've lied your feeding time, your last feeding time, and then you get that nausea and vomiting, you will aspirate. And that are some of the repercussions we try to avoid in our OR, because it can be lethal. It can even lead to death. That's the reason we emphasize on your time that you last fed, to avoid something we call aspiration or regurgitation and what have you. The second thing, allergies. What are you allergic to? What kind of medications are you allergic to? Maybe when you react to penicillin, macrolides, you should tell your doctor what you are allergic to. Then you should tell your doctor about history that you've had with anesthesia. If maybe suppose you've had a previous surgery, how did you react to what happened? If there was anything, a negative occurrence, you should tell your doctor. Maybe you have a family history where when you go intra-op or in the operating room and you are given the anesthetic drugs, your temperature rises. Some we call malignant hypothermia. You are advised to tell your doctor so that he or she may be prepared in case of such a scenario, or he or she may know what to use or what not to use. Yeah? At least emphasize you've given your history. Maybe there are some of the medication, anesthetic medication, that they did not go well with you during your previous surgery. Or maybe the kind of surgery previous done on you. Then another thing you should say when giving your history of anesthesia, when was the time, the difference between the today that you're being done this surgery and your previous one. Sawa sawa. Let your doctor know. Another thing your doctor should know, it's your medical history. And when I talk about medical history, I mean maybe you can't climb stairs. You start having tight chests. You start having palpitations, things like such are the things that your doctor should know, because they can be an indicator to an underlying condition. Maybe the doctor, if you be open and you say you cannot even walk a distance, it can be an indicator of maybe lung and maybe heart disease. And this doctor, when operating on you, will request for further investigation, or this doctor will take much precaution. But when I say about you cannot walk, let us exclude someone maybe who is going for a knee replacement surgery, or someone who maybe you've had surgery, orthopedic surgery involving your limbs. At least those ones, we have the reason why they cannot walk. It is because of the orthopedic surgery. They don't have any other issue. Some bonus points of what you should do the night before surgery. Another bonus, 2 bonus points: have enough rest so that you can recover without anxiety. Sawa. You can recover well. There are some doctors who even go to an extent of giving you some drugs to calm you prior to surgery. Then another thing, you should clean. You should take a shower, and you don't apply lotions, oils. Maybe if that's wherever they are operating on, you are hairy, at least you are advised to trim. Surgery is like tummy tuck. You are advised to trim your hair. It will prevent in maybe a lot of things. It will be good for infection prevention or infection control. Sawa. Until next time, bye.